All right, hello. My name is Avery Clark. I am one of the second semester students going into Surg, and I'm going to be demonstrating a focus assessment and a head-to-toe assessment on a patient with the lap chole. So I'm going to be coming here, making sure it's the correct patient's room, conducting hand hygiene before I walk in, make sure I announce myself and introduce myself. Hello, my name is Avery. I'm going to be your nurse today. I just wanted to check how you're feeling right now. Do you have any pain?
No, just a little soreness, but it's tolerable. It's not a big deal.
All right. I'm going to confirm. Can you tell me your full name and your date of birth?
Yes, my name is Lois Kim, birthday 9/10/82.
Perfect. And do you have any drug allergies?
Nope, don't have any allergies.
Perfect. Now, while I'm doing this, I'm also just doing a quick assessment of the room, making sure that all the emergency equipment is in place, such as an ANBU bag, as well as the standard equipment that should be here. I see that there's a vital sign machine here, so I'm going to be using this in just a moment. And can you tell me a little bit more about the pain that you had? When did it start?
Oh, since last night, but again, like I said, it's not a big deal. I'm fine.
And if you were to rate that pain between 0 being no pain and 10 being the most pain you could ever experience, what would you rate that pain right now?
Maybe like a 2.
Okay.
Yeah.
And what's a tolerable level of pain for you? Would you on a scale of 1 to 10?
Tolerable for me is like a 5.
Okay.
Yeah.
Gotcha. So that being said, would you like any medicine once we're done with the assessment afterward?
Yeah, sure. Just to get ahead of it, probably. I don't want it to get worse.
Absolutely. And I was looking at your record and I saw we have some Tylenol. We also have something a little bit stronger. If you feel like your pain is low, maybe we can start there with the Tylenol.
Yeah. I think that's a great idea. Yeah, let's go with the Tylenol.
Perfect. All right. So I'm going to be taking a look at your surgical site, if that's okay.
Sure.
All right. I'm going to be pulling this up. And I'm going to see here that the surgical site is covered by a dressing. The dressing is clean, dry, and intact. There's no amount of bleeding that's been noted here. Have you noticed any bleeding in the recently, or any feelings of wetness in that area?
No. I think
good.
Because weren't the incisions really small anyway?
They were, yeah. One of them is there's actually going to be between 3 and 4 incisions. I can't really see immediately right here, but I believe I reviewed the doctor's note and I saw those 3. 2 of them are going to be from the poles that are actually used to help actually do the surgery, and one of them is to help pull your gallbladder actually out. So that's a little fun fact for the day.
Yeah.
All right.
Thank you so much.
Yeah. Now, have you been able to have a bowel movement?
No, not yet.
Okay.
I'm hoping.
Have you had any been able to pass gas though?
Yes.
Perfect.
For sure.
Good. Sometimes our bowels are the very last thing to wake up after surgery, so we do expect a little bit of a slow return for those bowel movements. But as long as gas is moving, we're okay, and we're feeling like we're on the right track. I'll be letting the doctor know that you have not had a bowel movement, and we may be prescribing some laxatives a little bit later if that's okay with you.
Yeah, sure. Anything to help me pass along. Perfect.
Now what I'm going to do is I'm going to lift your bed up so that I don't destroy my back completely. Right. And what I'm going to be doing is I'm going to be palpating around that area, okay? I'm going to palpate the incision area last, and that'll be very, very gentle, okay?
Great, sounds good.
I'm going to be putting on some gloves before I do so. Normally these would be my size. All right. How does that feel?
Oh, feel fine.
Okay, good. That's the left upper quadrant, left lower quadrant. And you let me know if there's any pain, okay?
Okay.
I'm gonna be very gentle.
No, I'm fine right now. Yeah, we're good.
Now I'm gonna be palpating around the dressing.
Okay.
How does that feel?
It's a little sore. It's not comfortable, but
Okay. All right, and we're gonna definitely want to make sure that area remains clean, dry, and intact.
Mm-hmm.
And if anything changes to that area, you notice any sudden bleeding, you notice that you get it wet accidentally, just let us know and we can address it, okay?
Mm-hmm.
All right. Now I'm going to be bringing this right back down, and from here, what we're going to do is we're going to do a focused head-to-toe assessment. That means I'm just going to do a quick overview of all the systems in your body just to make sure that we have a good baseline for the day. Is that okay?
Mm-hmm.
All right, so that's going to involve touching you, and I'm going to let you know whenever that happens. So I'd like to begin at the top of your head. Is that okay?
Yes.
All right, so I'm going to be feeling the area, noting any contusions, any observing visually to make sure there's no bleeding or any other issues. I don't see that there are any, so that's good. All right, are you able to hear me?
Yeah, yeah.
And have you had any issues with your hearing in the last, since you've been admitted to the hospital?
Oh, no. I haven't noticed anything.
Perfect. And you're able to see? Do you have any issues, seeing or any changes?
No, I mean, I wear my contacts, but if I don't have my contacts, then yeah, I won't be able to see.
Gotcha. I'm also going to be looking behind your ears, making sure there's no issue. And can I have you turn your head to the left and to the right? What I'm doing is making sure that there's no jugular vein distension in your neck.
Mm-hmm.
Alrighty. Now, do you happen to know where we are? I know that's a silly question to ask right now since you've been able to answer these questions, but it's part of the assessment.
Yes, so yeah, I'm at Grossmont Hospital.
Okay, and do you know why you're here?
Yeah, I just had a laparoscopic colostomy.
Cholecystectomy.
Cholecystectomy, yes.
Perfect, that's very good though. And that's excellent. And do you know what year it is?
Yes, 2025.
All right, do you know what month it is?
October?
Perfect. All right, that's good enough for me. All right, so what I'm going to be doing is have you open your eyes and follow with just your eyes. Follow my finger. Okay, I'm seeing that you're keeping it focused. You're able to make sure that that your eyes are able to follow. All right, and what I'm going to do is I'm going to have you look straight at this ear right here. Perfect. Now I'm going to be observing your pupils, and with a little bit of a light in there. One time I'm looking at your pupil that I'm shining the light in, and the next time I'm looking at the other eye to make sure that it's accommodating. I see that it is, and that your pupils were at 4 millimeters, which is very normal. And I'm going to be doing the opposite side, so just look at this ear, checking the eye, and then checking the other eye. Good. All right. Now, have you noticed any soreness or lesions or any kind of bleeding or anything unusual in your mouth?
No.
Good. Now, I'm going to be looking at your face for symmetry, making sure that both sides are symmetrical. I'm going to have you go like this with your face.
Okay.
And then say, ah. All right. I'm observing your tongue as well as just inside your mouth, and I'm not seeing any issues, which I'm really happy to see. Alrighty. Now, I'm going to be going a little bit further down. I'm going to be checking your skin right here to see if there's any tenting. And since there's not, I'm seeing that you are pretty well hydrated, which I'm glad to see. Have you been able to eat and drink since you've come out of surgery?
Mm-hmm.
Good.
Yeah.
How's the breakfast here?
Decent. I can't complain.
You're very kind. All right. And I'm going to be taking a quick listen to your heart right now and going from there, okay?
Okay, sounds good.
All right. I can hear our sound here and here, and then going down. And I'm going to have you lift your breast, if that's okay. Then you're lifting your breast, and I'm going to be listening to the apical pulse for 60 seconds, right here. It's nice and strong. Good. And then listening to it laterally right here. Good. All right, I don't hear any issues. And I'm also going to be checking your capillary refill right here along the both hands, both fingers. I see that it's refilling within 3 seconds. That's good. And I'm also going to be feeling your pulses bilaterally. Here we go. Good. All right, I feel them both nice and strong. All right, and I'm going to actually get your vital signs right now as well, because I always like to do that first to just get this started, kind of go head to toe. So I'm going to take your temperature, say ah. Good, is within normal range. I'm going to be, I see that you're already on the blood pressure cuff right here, so I'm just going to attach it and take your blood pressure. I see that it's 120/80, which is an excellent blood pressure, especially out of surgery.
Yes, thank you.
Keep it up. And I'm going to get the pulse oximeter. Now that this is done completely, I can use this finger. Oh, not the phone. and I can see that your pulse is 70 beats per minute at 98% on room air.
Okay.
I know that you have this right here. This is not actually here because, you know, you're not actually getting oxygen right now. Do you use oxygen at home?
No, I don't. No.
And do you smoke or anything like that?
No.
Good. Have you had any troubles breathing?
No.
Good. All right, if you have any trouble breathing, that's one of the things we definitely want to know. And so I'm going to be looking at your chest to see even rise and fall of the chest. And I do see that. And I'm going to be listening again right now to make sure that I can hear the breath sounds, okay? So we're going to be taking some deep breaths from you, okay? So deep breath in and out. In and out. In and out. In and out. And then once again, I'm gonna have you lift your breast for me. And out. And then one more time over here. Good. They sound pretty good. No crackles, no snaps, no pops. All right. And we've already checked it and looked at this area. Just very quickly, I'm going to make sure that this. Did you feel any pain?
No pain.
Good. No sweating, no edema that I'm noting, so that's great to see. Have you been able to have a urination?
Yes.
You've been able to urinate?
Yeah, this morning, yeah.
Perfect. And can you tell me a little bit more about it? Did it hurt, or do you have any burning sensation when urinating?
No, it's pretty normal.
Good. And what color was it?
Yellow.
Yellow? Particularly deep yellow, light?
Little yellow?
Little yellow? That's good. And last but not least, have you had any smell with your
No.
And no strain, like you can see through it, it's clear.
Yeah. No, I don't have UTI. Yeah.
Oh, good. And have you had any lesions or any issues with your genitals or groin area?
No.
Good. And if so, I'm gonna, as long as you're okay with me skipping that part to maintain your modesty, I'm okay with that. Is that so?
Yeah, that's fine. Yeah.
Perfect.
I would, if I had issues, then that'd be a different story. But.
Sounds good. I'm gonna keep going down your legs, not noting any edema, any pain.
No pain.
Good. All right. So I'm going to be bringing these down, continuing to look at your skin, and I'm not seeing any other issues with your skin, and no breakages, including on the feet or under the heels. Alrighty, I'm going to take your pulses right here. That's good. And that's good. So this is your dorsalis pedis, and this is your posterior tibialis pulse, just in case you wanted to know. I'm going to be going like this right here.
Okay.
Good. And while we're down here, I'm going to have you push against my feet.
Okay.
All right, against my hands.
Uh-huh.
And then push again on the opposite side.
Uh-huh.
And then on the outside.
Okay.
And then on the end.
Okay.
And then I'm going to have you bring your knee up.
Okay.
I see you're able to do that well.
Uh-huh.
Good. Have you had any pain in your legs?
No.
Good. And then on the opposite side as well.
Mm-hmm.
Excellent. All right, I'm also going to have you squeeze my hands as evenly as possible.
Okay.
Good. I see that you're able to do that. Now I'm going to also have you put your hands against mine. Go against, and then against, and then up, and then down.
Okay.
And patty cake. Alrighty. Now how is everything at home? Do you have a good support system there?
I have my husband and my kids.
Good. And have they been able to visit you in the hospital?
My husband will be by with the kids in a little bit, so we'll see each other soon.
Good. And in terms of your hospitalization, has everything been okay?
Yeah, no, I mean, it's just a quick procedure, and I know that, I probably get discharged soon, right? So.
Yeah. We'll hopefully today, maybe tomorrow.
Yeah, sounds good. Okay, yeah. No, I don't have any issues.
All right. I'm glad to hear that. I just have a couple more things. I'm going to be checking your IV site. I see that it's dry and intact. I don't see any issues with swelling or redness or heat from that area. And yeah, so we're looking good. And I see that in the charting that it was started yesterday, so we're still okay with that. Now, I'm also going to ask that you turn over to your left-hand side, I'm going to be very careful about that site so that we don't irritate it or cause any further pain. And so I can check your back and listen to your breathing again. Is that okay?
Yeah, sounds good.
Alrighty. And I'm going to have you take this arm and then reach across and then hold this position right here. That's good. Now I'm looking on your back and I'm not seeing any issues, any abrasions, or any openings in the skin. And that's good all the way down. And I'm going to be taking a quick listen to your lungs one more time.
Okay, sounds good.
All right. And we're going to be starting at the bottom this time, okay?
Okay.
Deep breath in. And out. 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 And one more time. In. And out. All right. Congratulations, you passed the test. You get to stay in the hospital.
What?
I'm just kidding. Oh. We'll talk to the doctor about that.
Okay.
All right. Do you have any questions for me?
No, just not at the moment.
Good. All right. So if you do happen to have any questions or concerns, I'm going to, I'll definitely be available. Here's this call light right here. You can use that to call me or call anyone that can help you out. And yeah, so I hope that you are doing okay. I'm going to take a look at what we've done already and just make sure we document everything. And we are good to go. Thank you so very much for your time.
Thank you. We'll
All
see you
right,
later.
See you soon.
Okay.